We are coming together today to talk about COVID, kids, and anxiety and how to navigate it. And I've got my colleagues here. I'll let them introduce themselves. Grace, do you want to go?
I'm Grace. I'm also one of the behavioral health consultants at COPA, primarily out of our Redmond location.
And hi, I'm Mark Goodman. I'm a licensed clinical social worker, and I work at the East Bend Clinic here at COPA.
Yeah. So we're coming together today because we've been getting lots of questions from parents about how do we support our kids? What are the answers that we should be giving, and what is too much or too little information? So one of the top questions we get from parents is, my kid is worried about getting COVID. How do I help support them through that? On top of that, they're worried that someone in the family is going to get COVID, like a grandparent or someone elderly. So Mark, you have any suggestions on what to do if a kiddo comes with a question like that?
Yeah, so what I would say is being able to stay present with where your child is and simply ask them open-ended questions. So if they express a concern, saying phrases like, well, tell me more about that, or, tell me what you're worried about specifically. And I think an answer that can often be helpful is to state the facts. There's a lot of information out there, a lot of it is not great. So being able to respond with accurate information based on the CDC guidelines and offering a lot of accurate reassurance. So things like, kids don't get very sick. And the reason why we're sheltering in place is it's a huge favor to our neighbors who are older, who have a lot of health conditions, and we're doing all the right things to stay safe. So a lot of reassurance, I think.
Grace, what would you have to offer?
I would echo all of Mark's recommendations. I mean, I think letting your kids lead the conversation. And so if they're asking the questions, they're definitely curious. And like Mark said, being able to offer them correct and accurate information so they're not trying to fill in the blanks with their own imagination or with information they're getting from social media, and also feeling comfortable and reassured that it's okay as a parent to say, I don't know the answer to that. Let's look it up together and let's try and find out. And really reassuring kids that it's okay to be nervous. It's okay to be worried. We're all in this together. And again, this sheltering in place and this staying at home and social distancing, it's all to protect the community. And so while the likelihood of kids getting quite sick is pretty low, we're doing this to protect our neighbors and our friends and our family.
Yeah. And I think too, opening the space, if they're worried about a grandparent, allowing them to FaceTime them and having those same conversations with a grandparent, asking them, like, what are you doing to stay safe? How are you helping to protect your body? So they can be reassured on different platforms that we're all taking measures to try and keep healthy. Okay, so another question we get all the time is if we have recommendations on a schedule, if a schedule is helpful for a family, versus maybe more a laissez-faire type approach to the day, kind of letting things go as they come. What would you say in terms of structure, routine versus something a little more lax? Grace, I'll let you start.
I would say that generally speaking, we all do better on some sort of routine and schedule, kids especially, knowing what comes next, what's expected of them, what they know is coming. It really keeps us all a little bit more on task, and it hopefully manages your day a little bit better. That said, every household is very different. And so those beautiful color-coded schedules that you might be seeing on social media may work for some families, but they may just not work for yours, and that's okay. And so figuring out a flow that works for your family, whether it's just keeping bedtimes, wake times, meal times the same, scheduling in time for schoolwork, time to get outside. Schoolwork doesn't have to happen within the confines of a regular school day, so to speak, something that just works for your family. Everyone is balancing different responsibilities and different household makeup. And so whatever works for you is really the best thing.
Yeah, and I think really you can make it fun, right? You can make it a family project to figure out, all right, what is going to work best for our family, so you can get some buy-in for that. But I like what you said, knowing what to expect can really decrease some anxiety for kids. and decrease some of those questions of when do I get to watch a movie or when do I get to have a show? You know, just knowing when that time is can really help kids and parents. Mark, do you have anything to offer?
Yeah, I would add that scheduling can be really helpful. I know in balancing that with just sort of this deluge of information that we're getting. I mean, I'm just looking at my email box, and there's probably 40 or more emails about what to do at home with your kids and creative projects. And with the information that we're getting from schools changing, it feels like every day, being able to start with a deep breath yourself as a parent and being able to say, perfection is not what we're asking for here. You're doing great as a parent, just being present for your kids, and the importance of role modeling good coping as the facts on the ground change is that's the real value. And to just give yourself a break, just start there. And then as you introduce some scheduling items, I think having it be a good mix and low on technology, I would second that. So having something fun that you can do that connects you to your loved ones in person, with all of the social distancing that we're having to experience, being able to connect with the people who you can, namely your kids, and having it be a mix of something sort of artistic or creative or musical. The things that I am most inspired by are kind of fun ideas that involve getting the whole family included, and using your guys' creative brains, I think is really great. So having sort of a skeleton schedule of a mixture of indoor play, outdoor play, we can still go outdoors even with the social distancing and that creative element. And then you can scale it up as you see helpful, and you can back off if it's feeling overscheduled. So
And I love what you said, Mark. I love what you said in terms of just being present, right? I think that is one of the biggest things that we need to remember here is we don't need to compare ourselves to social media parenting. Just the fact of being present and having conversations and just doing our best right now, I think it carries a lot.
Yeah.
Yeah. So on that note, what do you guys have any suggestions for screen time? I know right now can maybe feel a little screen time heavy with online learning, downtime. Either of you have recommendations on what that should look like? Grace, maybe I'll start with you.
So screen time is really hard to get away from these days, especially as you mentioned, Regina, a lot of schoolwork is being moved online. And so this is where a little bit of a loose schedule can be really helpful in trying to balance screen time for school versus screen time for fun, and screen time just to give you as a parent a little bit of a break. And as Mark said earlier, social distancing is not social isolation. And so breaking up screen time with walks outside, doing something creative, getting some other movement in is really, really helpful. And schoolwork does not have to happen all in a chunk the way a regular school day does. You can break it up, and that's probably better for everyone too. So everything in moderation, whether we're in a COVID-19 pandemic or not. And so as much as you can, balancing out screen time with other activities is probably the best thing, but also know that it's okay if it's a little heavier these days with the schoolwork.
All right. And final question that we have here. My kids notice that we are stressed about finances, stressed about work. What can we do to reassure them that this too will pass? Mark, do you have any suggestions?
Yeah, and I would say that, when you have conversations about what concerns you, it's important to do that with your adult support first. And again, it returns to staying present for your kids. So in the same way that you would maintain the basics of good attachment and reinforcement strategies at any other time, pandemic or no, it's important to continue being able to have a conversation with your kids that is age appropriate. So if you're concerned about finances and the kids bring up this concern, being able to offer reassurance that again is accurate, being able to say, yeah, you know what, this is different, and daddy is home rather than at work, but as things change, we're continuing to plan to adjust to the changes, and being able to offer an answer that's both authentic but also in broad strokes and really
Mhm.
concrete, so centered on kind of what the child is needing, which is reassurance that, you, mommy and daddy aren't going anywhere, and that we'll be able to still remain a family, the things that are really important and sort of focused on the kid, and have those conversations about concerns with your partner or with other loved ones and family so that you can be present for.
Yeah, and I love it. I mean, kids really, they just want reassurance right now, right? They don't need all the facts. They don't need everything. They just want to know that things are going to be okay, and that their family is going to be there. So I think one topic that we haven't really talked enough about is self-care for us as parents, right? We really need to have this be a part of our structure, a part of our routine, so we can show up for our kids now that we're with them 24/7. So any tips, maybe strategies that you guys are doing for self-care, suggestions? Grace, what are you doing for self-care right now?
I think intentionally creating time for self-care is really important. If we don't put it aside, schedule it in, be aware and consciously plan for it, it doesn't always happen, especially in this day and age. And self-care can look like giving your kids 20 minutes on screen so that you have just a second to breathe, or switch with a partner at home if you have one, that they're watching the kiddos, you're doing a little bit of work, or you're getting a breather in, you're taking a walk, whatever feels like it's helpful for you. Remember, we're all cooped up together. And so, preserving time, not only to take care of yourself, but just to get some alone time. Your kids are going to need a little bit of alone time. You're going to need a little bit of alone time, and that's okay.
Yeah.
So really highlighting that and being intentional about it is really helpful.
Yeah, us as humans, we do need some alone time. Even the extroverts out there, we all thrive off of it to hit reset. Mark, what are you doing for self-care, or do you have any tips for other parents on how to make sure we get it?
Yeah, I would recommend not reinventing the wheel. So all the things that have been really helpful for you in the past, either sort of a slightly altered version. I'm thinking of folks who really feel good after a jog. So it's being able to continue the jogs, or if playing a few minutes of guitar is really rejuvenating for you, do that. Do all of the things. So most of it is not straying away from the things that are tried and true and that work. And interestingly, what we're trying to balance is sort of isolating or avoiding isolation and balancing that with connection. And 5 or 10 minutes in your room and taking a breather, or asking your kids to offer themselves 5 or 10 minutes is not self-isolative, it's self-care. But 4, 5, 6 hours of either you or your children in their rooms, that's feeling a little bit more like isolation. So, and if you love going to a yoga class or a Tai Chi class, consider a YouTube version, or if you know a few sun salutations, you can do that as a home practice. So it's doing the things that really support and bring you joy, but just in its altered version. So adaptation and flexibility.
Well, thank you, Mark and Grace, for joining me in this conversation. If you, as a parent, would like to meet with one of us virtually over telehealth, feel free to give COPA a call, 541-389-6313, and we'd love to meet with you and help support you and your family. Thanks.